Step 24, antagonist injections. In IVF, you do 3 different types of injections: stimulation injections, down regulation injections, and maturation injection. Antagonist is a down regulation injection. I will explain what down regulation means. In natural menstrual cycle, when you're developing large follicle, your pituitary gland senses there is a follicle which is ready for ovulation and release the egg. In order to ovulate that follicle, your pituitary produces surges LH hormone, that is an ovulation hormone that causes ovulation. So in IVF, we don't want this to happen. Why? Because we want to collect those eggs. So we don't want your pituitary to mess up with your cycle and surge LH and ovulate while we're doing stimulation before the egg collection. So for that, we need to block your pituitary. So in IVF, we don't want to have only one follicle. We want to get 10, 15 eggs if we can. For that, we need to block your pituitary so that your pituitary doesn't sense increased estradiol hormone levels, and then we continue until your follicles are ready for the trigger. Then we give a trigger shot, then collect your eggs. So as we said, there are 2 different ways of blocking pituitary. One is agonist and second is antagonist. We will be talking now about antagonist injections. So there are 2 different types of antagonist injections: cetrorelix and ganirelix. So cetrotide is a cetrorelix and ganirelix is orgalutran. So they're equally effective. In terms of storage, you need to store these medications in for long-term storage. You need to keep these medications in the fridge between 2 to 8 degrees. Also, you can keep these medications in the room temperature less than 25 degrees for up to 3 months. So in terms of these injections, when you start these injections, okay, so you had a menstrual period and you started your FSH stimulation drugs from first or second day of your menstrual period. Then later on, you need to add antagonists. You don't need to add antagonists too early. Why? Because your pituitary doesn't sense there is a large follicle, and because your estradiol levels are quite low, and you don't surge LH hormone very early on. But because we stimulate your ovaries, because you produce a lot of follicles, a lot of estradiol levels, from day 5, day 6, day 7, your pituitary starts sensing and start producing LH. Before that, we need to give antagonists to block your pituitary. There are 2 different types of starting of antagonists. One is called fixed. The second one is flexible or variable. Fixed means that you start FSH antagonist injection on certain day for all patients. Usually it's day 5 or day 6, sometimes maybe day 4 of stimulation. When we say day 5, which means 5th day of stimulation, which means 5th day after starting your FSH. So days in IVF goes by day 1 is the first day of your injection, not menstrual period. First day of injection is day 1, like we said earlier. So day 5th means 5th day of injection. Normally you start antagonist injections if your period is approximately 28 days or less. If you have a very long cycle, more than 28 days, you start on day 6, because you ovulate a little bit later. It's safe to start on day 6. You may need to start earlier than that, day 4 even, if you had surge or ovulation during IVF in your previous IVF cycles. So which means you need to block your pituitary early on so that you don't surge LH hormone. So for that, you may need to start from day 4. You don't need to worry about starting too early. You don't need to worry that you will have a low egg number if you start too early. Why? Because antagonist doesn't impact your ovarian stimulation. Why? Because it doesn't even talk to your ovaries. It just blocks your pituitary gland. So you can start on day 4, day 5, day 6, doesn't matter. You have the same outcome because your ovaries do not even sense that antagonist drug is there, because they don't have receptors for that. Okay, so then second type of starting is a flexible start. Some clinics do flexible start, which means they do monitoring of your bloods and ovarian response on day 4, day 5, and decide whether you need to start antagonist or not. So usually they start antagonist if your LH is higher than 10, estradiol higher than 600, or if you have a follicle which is larger than 14 millimeters. If you don't have any of this, then you continue injections, then repeat the scan and blood tests, then start. Downside of this flexible start is you may need to do number of scans and blood tests just to decide when to start Antagonist. It's far simpler if you do a fixed day start without doing additional scan and blood tests. So in terms of frequency, is you need to do these injections every 24 hours. Because if you delayed your injections a little bit, you don't need to worry too much, because these injections stay in your blood in a good concentration up to 30 hours. But you need to notify the clinic saying that you had a little bit of late injection. So normally, of course, you need to follow your clinic instruction. Normally, if your clinic is closed, if you realize you missed the injection, safest thing is to give that missed dose of Antagonist injection and immediately contact your clinic. Then your clinic usually does a blood test and ultrasound scan to make sure that you didn't have a surge of LH hormone. Of course, that's just general instruction, but you need to follow your clinic's instruction on Antagonist injections. So normally you do, for convenience, you do Antagonist and FSH around same time. It's usually in the evening. Once you get blood tests and scan reports, you get instructions saying continue your Antagonist and continue your FSH injections. So from practical purposes, these are instructions in terms of getting these injections right. You need to put alarm clock on or notification on so that you always remember that it's time for your injections. Then every time before you do injections, you need to check the name of the drug you need to inject, the dose of injection and time of the injection which on the instruction which is sent by clinic. Then dial the right dose of orgalutran or cetrotide, then inject just under the skin. So, and again discard the needle into a safe container. So generally getting Antagonist injections are very critical, because if it is not given correctly, then it may cause significant stress, which is due to cancellation of your cycle, because your pituitary wasn't blocked properly and you had a surge of LH hormone. Then the chance of getting eggs is very, very low or close to zero. So yeah, that's Antagonist injections.